Raja sir is here and Dr. Ashish, are you there?
Yes, Srinivas.
Yeah. So since you are spearheading the movement of biosimilars in India and abroad, so now we all know that the Intas Razumab has well cleared it. We knew that any biosimilar which comes into the picture, leave about biosimilar, if you take about aflibercept, that also had a teething problem. If you look into the Lucentis, that also had a teething problem. So any new products in the initially will have these teething problems, right? So what should the general ophthalmologist or a vitreoretinal surgeon looking for? Because in the initial period, many of these injections are showing sterile inflammation. So which one to choose, which not to choose, how should they go upon it? You and then followed by Dr. Raja sir.
So I think, now the gold standard is pretty high. So anything which comes new will always be compared with what we have in, existing. So until unless you have mild IOIs, nobody minds it. But, the main thing that we are seeing with brolucizumab, the brolucizumab has taught us that rather than just seeing the mild IOI, try to look at the periphery, because that's what happened with Hawk and Harrier. It was missed. So it means in anything which comes new, I would be a little more careful in my examination and in terms of, that examining pre-op and the post-op, and go slow rather than going fast.
Raja sir, coming to your question, sir, many these samples are coming. In fact, we are seeing the biosimilar Avastin also being available nowadays, and they are approved by the Indian government. So is there any recommendation which VRSI can give? Yes, this is safe to use, or how should the surgeon or a vitreoretinal surgeon decide? Because many such companies are coming up which are getting an Indian approval.
Yeah, so there are two different aspects, Srinivas. One is the government approval, and by law, I think it's an independent process of the government. They have their committees, subject matter experts. They evaluate. They can take the inputs from different societies if they want. But once a drug is approved, there may be some guidelines which may have to be released from the society perspective. Uh, and those are the places, I mean, indications or kind of usage protocols, what kind of treatment frequency, and what to look out if there is an inflammation, like for brolucizumab, how to manage those kind of inflammation. Those can be given as guidelines post approval, but pre approval, it's in the domain of the government. But if they ask, I would say that then there has to be uniform process, not just for retina procedures or anything. I mean, they can come to any society for guidance before they go for approval. But again, I don't know, this is repeatedly coming again and again, that Cipla or Reliance, their products are not approved. That would be illegal. So I don't know. I don't want to comment on it, whether they have or they don't. I'm assuming they have the approval, and that's why they are in the market. Yeah.
Okay. Thank you, sir, for that, making it clear. Dr. Debulal, sir, you have any comments to make?
Well, actually, the issue with other biosimilars are, it's very difficult for any society, I guess, or the government to control, because these the people who are marketing, they just come and hand over. In fact, yesterday I had a couple of people from different companies coming and asking me to use their products. I said, no, this is not how it works in Disha. We have a approval committee which approves a drug after having seen the DCGI permission. And that's what happened with Razumab also. Initially, we were quite skeptical about, if I can use that word, about using this biosimilar ranibizumab when it came. And initially, of course, we did a pilot trial of around 30 vials, and then we actually offered it to all the patients who actually come. Yeah, I think a protocol has to be there from the hospital or the individual practitioner concerned. And we should not be jumping the gun, because our primary duty as a physician is to help the patient. If not possible to cure the patient, at least we should do no harm to the patient.
Thank you, Debulal sir. One question to Dr. Ashish. We are now hearing the biosimilar about aflibercept as well. So how is it going? Where is the future of the biosimilar going? In few quick comments.
Means aflibercept biosimilar has led a long time, because aflibercept had patents on various aspects of means manufacturing process. So they keep on delaying. So I won't expect aflibercept coming in before 2027. So but anyway, I think so anything which comes up, we have to take in the same way, little more cautious.
Okay. Last comments, Raja sir, about the Zib aflibercept. Because aflibercept is 45,000. It is pretty expensive for the tier 2 and tier 3 cities. So of course, Roluzumab is coming up, but they have their own teething problems, and it's now coming up. But what do you suggest, sir? Zib aflibercept would be the choice for the patients who are not affordable, who are not responding to Lucentis, Raja sir?
See, first of all, Zib aflibercept is not a biosimilar. It was a molecule which they had prepared already with a different osmolar concentration. But overall, I would say the Zib aflibercept, which we use intraocularly for the same volume, 0.05 ml, it is only 1.25 milligram, whereas aflibercept inject inside is 2 milligram. So you cannot equate or equally compare it with apples to apples. But in case you are getting inadequate response with some drug and you want to give aflibercept as a switch, Zib aflibercept is an option. But even there, if sometimes it's not coming with the 0.05 ml of volume which you are inject, you can give 0.08 ml to make it 2 milligram and try giving those. But overall, India is the bread and butter of our biosimilars. So many biosimilars are now available in India, but the regulatory process has to be strengthened, and real world data has to also be used. And that's what I think what Ashish mentioned, that DCJ is asking for more data. They usually give this kind of letter for all approvals. We will need more data. The interpretation is okay. You can go to the market. Now you are legally, but they will ask for more data.
So thank you so much. Thank you, Ashish, for the wonderful presentation, and looking forward to more such because it's now the need of the hour. The biosimilars are going to be the need of the hour. There's so much of unmet need in our country and so much of people below the poverty line. I think that's going to be the future. Thank you so much for your lucid presentation. Thank you, Dr. Debulal sir, for sharing your experience as well. And as always, Raja sir, very lucid and crisp in his comments.